field of reproductive health and justice. They're going to share with us, the state of RJ in different communities, what's happening on the ground, and also to hear from y'all what's happening and perhaps plug into some of the action that's happening, and also to let us know, like, oh, this is what we're doing and moving. So we're gonna be really open to what a strategy session looks like. We're gonna be like kind of moving in and out, ask us questions. They're experts, a lot of skills, a lot of knowledge. So what's gonna happen is that I'm gonna intro them, and they're gonna do some presentations to really give you a good look around what's happening in communities. What is the attack looking like? Because the attack is real. And, and also ways that you can plug in into galvanizing, support to beat back the attack. And also, again, having your voices plug in so that we can know what's happening in different areas around the country and different communities. So I'd like to first do a really brief intro of our panel and then give an overview of what they'll be discussing, and then they'll just jump in. So I'm pleased to be on the panel with, again, rock stars, in my opinion, great folks to do this work with. Who will be leading us off is Miriam Yeung. She's the Executive Director of the National Asian Pacific American Women's Forum, Natpop. This incredible organization, it has been really wonderful to watch grow in just incredibleness over the years. Guys, the country is the only national multi-issue progressive organization dedicated to social justice and human rights for Asian American and Pacific Islander AAPI women and girls in the U.S. There's offices in D.C. and in New York and chapters in 13 cities. The current priorities of this organization include winning rights for immigrant women, exposing the myths behind sex-selective abortion bans, leading community-based, I don't know how to make this be quiet, I'm sorry. I'm making the noise right now. It's on mute, hopefully that'll work. I'm part of a family text, so a group text with my family. They get excited on the weekend. And leading community-based participatory research with young AAPI women and conducting national AAPI opinion polling. Miriam is going to share with us the exciting work Natpop has been doing around sex-selective abortion that's been happening not only on the state level but also nationally, right? Right beside Miriam is Karla Torres. Karla is the Human Rights Fellow at the Center for Reproductive Rights, where she uses international human rights mechanisms to hold the U.S. accountable to its international human rights commitments. That is an incredible task. She previously was the Assistant Director for the Reproductive Rights Initiative at the Human Rights Law Network based in New Delhi. And Karla's going to share with us this collaboration that the Center for Reproductive Rights is doing with the National Latina Institute for Reproductive Health to really amplify the voice and increase access for immigrant women in the Rio Grande Valley and Texas. And beside Karla is Nourbese Flint. Nourbese serves as the program manager with Black Women for Wellness. She directs the reproductive and environmental health policy, does the organizing around community advocacy, and manages the reproductive justice programming. She also serves as on the steering committee with the Californians for a Healthy and Green Economy, where she strategically looks at the political landscape and helps assign to build power and address toxic chemicals as it relates to reproductive health. So, awesome. And Nourbese is going to be sharing about a national initiative called In Our Voices. That is, again, a national initiative advancing a national Black women's reproductive justice initiative. So they're going to share with us their great work, and then we're going to open it up for questions, queries, and and get some ideas around what's happening in your communities as well, as it pertains to women of color on the front line of struggle for our reproductive justice. So Miriam.
First up. All right. Thank you all. So happy to be here still and to talk about racism and reproductive injustice and one very creative invention by our opponents, aka sex-selective abortion bans. So really quickly, just a little word about Natpop, the National Asian Pacific American Women's Forum, if you are not familiar with us. We have rocking t-shirts as well that all my staff are wearing, and good swag at our table, and you should come visit us. But as you heard, Natpop is the only national organization representing Asian American Pacific Islander women and girls in the country. We're progressive, we're multi-issue, meaning we do work not only in the repro rights, health, and justice space, but also do a lot of work in the immigrant rights movement, and also the economic justice movement, and also violence against women's movement. And we have this grassroots chapter structure where we're actually in 15 cities across the country, and we do all our work in the service to change the systems that impact our communities' lives. So we do policy advocacy, but in order to do policy advocacy, we do a lot of base building, a lot of leadership development, some of our own research work, as you heard me say this morning. There's very little research on our community, so we do some of it ourselves. Communications and public education, and a lot of strategic collaborations with friends here and also around. So, to dive right into it, who's heard of the sex-selective abortion ban story already? All right, so most of them, great. For those who haven't, here are the folks who invented it. In 2008, Natpop actually got a call from Trent Franks because his staff were sure that Natpop would love this new bill that he was working on, because it was all about saving little baby girls, particularly little Asian baby girls. Turns out the first version that he proposed in 2008 was called the Frederick Douglass Susan B. Anthony Prenatal Non-Discrimination Act. And when you read the text of the law, the first line is, "Sexism is terrible." I'm paraphrasing. You know, it's one of the worst things that happens in our country. And then the second page is, "Racism is terrible," and worst thing in the country, because in the first versions of the bill, these were race and sex-selective abortion bans. So the premise was that we should criminalize doctors who are providing abortions based on the race or sex of the fetus. And they were using all of our language. Like literally, when you read the text, it reads like a human rights document. Right? So this was a vehicle that Trent Franks has been riding. It was actually created by the pro-life movement much earlier, like decades ago, where we have them on record in the early 90s saying that we should use the issue of sex selection and sex-selective practices as a big wedge issue. And obviously, you can see what it does for their side, right? Like it allows them to pretend to claim to be feminists, right? Like they care about girls more than we do because they're trying to prevent the abortion of little girls. Right? And they get to claim that they're being anti-racist because we care about those little brown babies. And it's been really galvanizing for their side, right? It's a base building method for them to mobilize people, to make them feel like what they're doing is actually helping women and brown people. And it was combined at the time, I don't have a slide for this, but you'll recall it was combined at the time with these billboards that went around the country that said, you know, the most dangerous place, or endangered species, right, with the image of the black child, or the most dangerous place is in the mother's womb or something, I'm paraphrasing, right? So legislative bill coupled with a communication strategy. The race-based piece was all about an attack on Planned Parenthood and where their clinics were, you remember, right? Like they started to say, oh, Planned Parenthood kills 50% of African American babies in this country, they're committing genocide. It's because where they're located, they target African American communities. Legislatively, the race-based piece tanked pretty quickly because obviously it's a ridiculous notion, right? And a completely made up notion. The sex-selective piece obviously is a little tougher and trickier because there are huge problems, right, in other countries. So let me back up. As I said before, the sex-selective abortion bans are laws that criminalize doctors. Some of these laws in the 8 states that they've been passed require nurses or doctors to report even suspected cases. And in South Dakota, requires providers to actually question their patients. Although when I was testifying in Congress and the lead witness on the pro-life side was asked, you know, how is this gonna be enforced? He literally said, if you see an Asian woman come in and she has 2 girls, we expect doctors to ask why she's having another abortion. So racial profiling in the doctor's office is the impact of these laws, we believe. It also perpetuates really negative stereotypes about Asian Americans. We're fearful that all the healthcare barriers that Asian American women, particularly immigrant women, already face will get exacerbated. Like, it's hard enough to find a doctor for reproductive health care, like doubly hard to find one that speaks your language, right? And has the right interpretation and also cultural competency to handle your issues in a confidential and safe and effective way. So layering on this level of scrutiny and surveillance is just a really bad idea. And we believe it interferes with that fundamental trust that we should be able to have with our doctors. Also, for those of you who are legal buffs, these bills are direct challenges to Roe v. Wade, right? And the interpretation of Roe v. Wade that said viability is the other line. So sex-selective abortion bans also open the door for a whole host of other reasons why abortions might be illegal. Sex-selective abortion bans, or so-called PRENDA laws, prenatal non-discrimination acts, were the second most popular anti-abortion ban in 2013. So it's like the sleeper story in 2013, but it was proposed like 26 times, second only to attacks on Affordable Care Act. And for the US, these are the 8 states that it's passed. And you'll see that one of the myths that that we cover in our report and that legislators will say is that all these other countries have outlawed this already. Why can't we do it? We're behind the times, as if they care about international standards, all of a sudden. But in reality, only 4 other countries have actual prohibitions on sex-selective abortion bans. And as I mentioned, it's been a vehicle where state legislators have been throwing out really ugly racist stereotypes about Asian Americans. They'll say, you know, these are cultures that look at sex selection abortion as being culturally okay. And I will suggest to you that we are embracing individuals from some of those cultures in this country or in this state. This is in South Dakota, where there are 9,000 Asians, literally. We know that people from those countries and from those cultures are moving and immigrating in some reasonable numbers to the United States. This is the senator from Arizona. A lot more Asians, actually, and was the fastest growing state where Asian Americans started to live. Trend lines for sex selection are there. With a multicultural society, America is becoming more of, we have to guard against that. They will bring their traditions into Arizona in a way that really defies the values of America, right? So all this xenophobic rhetoric. So even if you accept those premises, it still is a bad idea, because we know these bans don't actually impact the issue. It doesn't actually solve the issue of son preference. It wouldn't even solve the issue of sex selection. And folks in the international context have done a lot of work and said a lot of things about this, including WHO and the United Nations. Obviously, we know fundamentally there is an issue with racial, gender inequity, right, in the world and in this country. And racial inequities can lead to son preference, which can lead to sex-selective practice. But at the root, it's gender inequity. And there's no way you can actually solve gender inequity or give women more rights by taking away their rights, right? Which is essentially what these legislators try to do. So we've published a report, which I'm going to come around and hand out because I don't want to take them all home, which busts some of the top 6 myths that legislators have used. We're going to share 2 of the most relevant ones. One is that, you know, these sex-selective bans are effective. Obviously, they're not only effective, but we did 2 studies which show in the states that had long-time bans, Illinois and Pennsylvania, there was no actual difference in time after the pass of the ban in any kind of sex discrepancies. And the other second biggest myth that they use is that sex ratios at birth, so the ratio of boys to girls or males to females at birth, for Chinese, Indian, and Korean immigrants proved that male-biased sex-selective abortions are happening. And we've actually re-looked at the data, looked at updated census data, and did some comparisons. And guess what we found? In fact, Asian immigrants are having more girls than white folks in this country. So I don't know, I think we have a surplus girl problem, and I think we really need to worry about those missing white boys. Where are the missing white boys? Okay. So Natpop is fighting back, and we've been using multiple strategies. One, we sued the state of Arizona, along with the NAACP. The ACLU were our lawyers. Arizona is the state with the race and sex-selective abortion ban passed. We've been beating back all the legislative efforts we can across multiple states by lifting up the voices of Asian American women to go testify and tell their stories. And we've also been putting forward a resolution strategy, particularly in the cities where there are lots of Asian Americans, like San Francisco, New York, Oakland. And these city councils are standing up and saying that, point blank, these cities welcome Asian Americans, and these sex-selective abortion bans are discriminatory and have no place in our state or city. So those are some of the 3 strategies that we're doing right now for sex-selective abortion bans. It's moving currently in Indiana. Indiana, goddamn, right? Like that's the new version of the 2015 song, right? Like there's so many problems with Indiana right now. But Indiana, Florida, Texas, it was even introduced in New York. So if you're from those states and want to get involved, give me your info, and we'll definitely stay in touch with you and welcome your help in these battles. Thanks. Thank you.
So, like Paris mentioned, my name is Karla. I'm a Human Rights Fellow at the Center for Reproductive Rights, and I wanted to talk to you all about this collaborative campaign that the Center and the National Latina Institute for Reproductive Health have been working on since late 2012. Our logo is Mr. Texas. Thanks for your patience. So we are working on this project, the National Latina Institute for Reproductive Health, which is an RJ organization based in DC, that looks at immigrant women in the Rio Grande Valley and their access to affordable reproductive health care. And it's a collaborative project that is really sort of worked on by women of color, immigrant women in the Rio Grande Valley, and for women of color. Our first publication was the fight for women's reproductive health in the Rio Grande Valley, and I actually have a single copy left. There were some in the RCC, but I have this one if anybody's interested in taking it from me, so that I also don't have to go home with it. So, in case anybody doesn't know, the Center for Reproductive Rights is a global legal human rights organization that holds reproductive freedom as a fundamental human right and tries to hold governments accountable for protecting, fulfilling, and promoting this right. The National Latina Institute is an RJ organization that also upholds the reproductive right reproductive health is a human right, and sort of elevates Latina leaders and mobilizes communities to create more Latina leaders and to change the narrative and in eventuality create policy change. So is everyone here familiar with what's happened in Texas in the last 2 state legislature sessions? Okay, so I'll just give a brief overview because it's been a lot. It's been sort of a perfect storm for reproductive health policy change in Texas. In 2011, the Texas legislature cut its family planning funding by 2/3 because it thought it was a good idea to do that. It also instituted what's known as the affiliate rule, which basically targeted Planned Parenthood clinics and other clinics that were affiliated with Planned Parenthood, even if they did not provide abortion services. So it meant that those clinics, and Planned Parenthood specifically, could not receive state family planning funding. And it also created a tiered system for dispersing the 1/3 remaining funding, and it placed clinics that provided only family planning services at the very bottom of that tier. Then in 2012, the federal government, which before matched state funds for the family planning program, decided that because the state family planning program was now discriminating against Planned Parenthood clinics, the federal government wouldn't give its matching funds. So the state lost $32 million in matching funds. The Title X funding that came to the state was actually, that had come to the state for many, many years, which is the family planning, like the federal family planning fund, actually didn't go to the state for the first time in forever and went to an independent consortium of providers because the state family planning the state family planning program was now discriminating against Planned Parenthood clinics, basically. Also in 2012, even though it has one of the highest rates of uninsured people, it decided to not expand Medicaid, and it hasn't changed its mind, and we don't expect it to. Then in 2013, it restored its family planning to pre-2011 levels, but it didn't do this it didn't disperse its funding to the frontline clinics that had been providing services to women in very rural areas, like women in the Rio Grande Valley, and instead put this money into community health centers that aren't as poised to provide these services to the women who actually really need them. And then it passed HB 2. Does everybody know what HB 2 is? Or does anybody? Okay. So it's this law that has 4 very harmful provisions that target abortion providers and abortion clinics. One of them is a 20-week ban. Another is a ban, is a regulation that, or an expectation that abortion clinics are certified as ambulatory surgical centers, which is very costly. And many clinics are not ASCs, of ambulatory surgical centers. It also requires abortion providers to have admitting privileges at a local hospital within 30 miles of their clinic. And then it requires abortion providers to only administer medication abortion according to an outdated and outmoded FDA protocol, which we've found now through evidence-based science is actually not necessary. You can take medication abortion later in your pregnancy and a lesser dosage, a safer dosage. So that has happened. So then why did we focus on the Rio Grande Valley? It's because the people in the Rio Grande Valley are targets of multiple forms of discrimination because of their geographic location, because of their immigration status. For example, 90% of the people who live in the Rio Grande Valley are Latino, 37% of them live below the federal poverty line. They are disproportionately impacted, like I mentioned before, because they're so isolated. They lack access to transportation, they lack access to culturally competent providers. They have the highest rate of uninsured in Texas, and in fact, Hidalgo County, which is the orange county, has the highest rate of uninsured in the country. And this all means that there are really poor health outcomes for a lot of the people in the valley in terms of unplanned pregnancy, higher rates of STIs, higher rates of cervical cancer screening diagnoses. But also because the National Latino Institute had been working in the Rio Grande Valley for years and had a really strong base in the Rio Grande Valley. And we thought we could further mobilize this community to actually engage and call for policy change. This is a video that I wanted to play, but I will save it towards the end in case we have time. But it basically tells a story of a woman we profiled in our original document who talks about living in an uncertainty over her health and having no access to a provider or services because she's undocumented. And she just has a very difficult story, but is very indicative of a lot of the stories that we heard in the Rio Grande Valley when we went down and did a fact-finding where we spoke to 200 women and asked them, what are the barriers that you live with day to day that keep you from accessing affordable reproductive health care services? So some of the campaign goals, first to document, to go into the valley and to get stories and then share them broadly, to use a human rights analysis to look at what are the barriers that the women are identifying and how do these constitute reproductive rights violations and what are those? To mobilize a community that was already very excited to be mobilized and to get out there and talk to their state legislators and policymakers, and then eventually to create some policy change. So some of the findings from this report that I mentioned before, a lot of women spoke about lack of accessible clinics, unaffordable prices of services, and especially contraception. A lot of women spoke about how they had to choose between contraception and providing for their family, how they sometimes shared contraception with family members or tried to get it from Mexico and then ran out and then had an unintended and unplanned pregnancy. Lack of access to transportation. A lot of these women live in what are known as colonias, which are unincorporated towns that lack electricity, drainage, just sidewalks. There's just no public transportation in these areas, and they're hours away from their local city center. And now with the closure of a lot of clinics because of HB 2 and because of the funding cuts, the closest clinic is, for example, in Austin, let's say. And these women are afraid to travel outside of their community and don't have access to a car or to gas money if they do have a car. Delays in cancer diagnosis and treatment. A lot of women have self-diagnosed or have had x-rays or mammograms and then been told, well, the biopsy is $700, and if you don't have it up front, then we can't give you an appointment. So this woman now lives with knowing that she has lumps in her breast, but not knowing if they're benign or malignant, and just having to live with the pain and the uncertainty of that. And their immigration status. Texas has internal checkpoints up to 100 miles inside the U.S. border. And if a woman is undocumented, and actually even if she isn't undocumented, she's afraid of these checkpoints because women can be detained, deported, separated from their family, and so they fear leaving their community. And so some of the violations that we identified were the right to life, the right to health, to non-discrimination, and to equality, and the right to be free from ill treatment, especially for the women who had been told that they had, cysts in their uterus, or who had lumps in their breast, and then were told, well, actually, we can't help you. And in fact, one of the women that we heard from most recently in a human rights hearing that I'll talk about in a second was actually told to go back home because she wouldn't be able to get care in the U.S. because she was undocumented, and she actually had advanced stage colon cancer. And she was just told, too bad, you're not going to get the help that you need here, so you have to go back home to Mexico. So this is the reality that women live with. So some of the work that we did, we started local. We engaged elected officials. We did a lot of letter writing. We launched the report in the Valley, and then we did mini launches all over Texas to try and get the word out and try and get more women involved. And these are just some of the pictures. We held rallies and marches and, like I said, letter writings, and we went in lobby days. At the state level, we've testified at the Capitol. We've participated in coalitions that are also working on RJ issues, and then we wrote this policy blueprint, which I only have one copy of, which has state level recommendations to the legislature that go more in depth into what the state legislature could do to increase access for immigrant women in the Rio Grande Valley. At the national level, we did a congressional briefing, and we did a HEAL Act advocacy day. The HEAL Act is the Health, Equity, and Access for Latinas and Families Act. That would basically remove the 5-year barrier, waiting period that immigrant women have to wait for before becoming Medicaid eligible. And then at the international level, we did written and oral advocacy before UN treaty review processes. The U.S. is reviewed for its human rights records every about 4 years under the 3 treaties that it signed and ratified. And so at each one of them, we brought this issue to the UN committee and tried to hold the U.S. accountable for these human rights violations. And for the first one, actually, we brought Lucy Felix, who's in the picture, who's a field organizer in the Rio Grande Valley, to come and represent the women in her community. And I think that was really effective because at the end of the day, we got the UN committee to specifically call out this issue in the U.S. and to recommend to the U.S. that it do something about it. And more recently, the U.S. is being reviewed under the periodic review, which just looks at the whole human rights record of the U.S. And this is, again, another issue that we're bringing up. So we're trying to amplify the issue and get as many people on board and to listen to us. So we've come back to Texas, and we, like I said, we produced this blueprint. We've also had another lobby day in Austin, and more recently we held a human rights hearing in the Rio Grande Valley. Like I mentioned before, a lot of women can't travel outside of the valley, so we brought 7 international human rights experts to the valley to hear directly from the women who are impacted. This is the blueprint. And some of the recommendations that we made follow very closely with the human rights violations that we had identified before. So, making women's health services affordable, available, equitable, acceptable, ensure women's rights to information, ensure women's continued access to safe and legal abortion, so repeal HB 2, and do away with the 24-hour waiting period, expand health insurance coverage, which specifically refers to the Medicaid expansion, and protect the human rights of immigrants, and refer specifically to the checkpoints that are in Texas. So this human rights hearing, we had 20 women testify, 17 of them were directly impacted, and 2 or 3 of them have been highlighted in the original document and came forth to share their stories. There were stories of, as you can see, access to sexual health, education and contraception, abortion, cancer diagnosis and treatment. And these were some women who had never shared their story publicly and who felt exceptionally empowered to do so in front of members of their community, and these 7 international human rights experts who do this work but know nothing about the Rio Grande Valley. So it was a very big moment for them. And after the hearing, we're hoping to produce an outcome document that goes a little bit more in depth into the human rights violations and does a little bit more analysis and includes the testimony that was given and the comments that were made by the international human rights experts. And we're doing that so we can reach more people and really, firmly cement this as a human rights violation, a series of human rights violations. This is a picture of some of the women who testified. So some of the challenges that I wanted to make sure to identify are organizational capacity. There are 3 people at the center who work on this issue, myself included, and though the National Latina Institute has been all hands on deck, they also have a lot of other projects going on, and this is a really big effort on both of our parts. So just in terms of having enough people to do all of the work that's necessary. The victim versus leader narrative, we wanted to make sure that when we talked about the women, we didn't just say they're marginalized, they're vulnerable, they don't have a voice, and these are all the health problems that they have, and so you should do something about it. We wanted to say, yes, they're marginalized, but they have a voice, and they know what their rights are. They actually now have copies of the Universal Declaration of Human Rights and use them in the community meetings to educate other women about their human rights, and to say the government is accountable for promoting and fulfilling these rights, and we need to let them know that we know that now. And they walk around with this document here, and they say, this is me on page 16, and this is my story, and these are the women in my community, and so you need to do something about it to their state legislators. So we've tried our best, and I think that they have found that that it's been effective to raise their voices as leaders, as Latina leaders in their community and in the country. And also sustainability. We've been doing this project since the end of 2012, and how do you sustain it, and how do you keep people engaged so that it doesn't just become a three-year project. And I mean, some of these are exceptionally obvious, but they resonate a lot with immigrant community, especially the human rights approach, the fact that you can carry your human rights with you across borders, that it doesn't matter whether you're documented or not, whether your national origin is from Mexico or El Salvador or Japan, that you have these rights because you are a human being. And that it promotes accountability for the US government and the state government as well. And the RJ approach just allows us to more comprehensively capture the lives of these women. It's not just that they're women, it's that they're from Mexico, it's that they're under the federal poverty line, it's that they are geographically isolated. It's a lot of different issues that these women really understand and feel like they reflect their actual true reality. And if you have any questions, I'm here. Thanks.
Thank you.
So hello, everybody. Again, my name is Nourbese, and I am with Black Women for Wellness. Black Women for Wellness is an organization dedicated to the empowerment, health, and well-being of Black women and girls, and we're located in Los Angeles. I'm going to be talking about an initiative that we are a part of called In Our Own Voices, National Black Women's Reproductive Justice Agenda. So I will, I forgot how to this go down. There we go. So I'm going to talk about the National Black Women's Reproductive Justice Agenda. I'm going to talk a little bit about why now and looking at Black women's status, and then strategies and challenges in the work. Everybody still with me? All right. It's a little cold in here, and I feel like energy is down. So, woo, okay. Do we need to do like a stretch break? We're good? We're with me? Yes? Okay. All right. So In Our Own Voices is the national organization initiative designed to amplify and lift up the voices of Black women at the national and regional levels in our ongoing fight to secure reproductive justice for all women and girls. It's focused on leadership, development, policy, advocacy, civic engagement, and education. We talked a lot about this in the last session, and if you want to know a lot more about it, you can definitely talk to myself or Marcella, who's also here, who is the coordinator of it. But I wanted to spend the majority of the time talking about why is this important and why right now when we talk about Black women's lives and what's going on with Black women. So one of the things I wanted to uplift, is that nationally Black women are kicking butt when it comes to voting. For the last couple of, since 1996, we have continuously been growing in terms of our share of of the representatives of the voting population. So I think we're about at somewhere between 66 and 70% of registered Black women voters vote in the in the presidential elections. Black elections.
Secret election.
I was supposed to say that was a secret.
Yeah.
Y'all didn't hear that. However, given that since that time in 1996, if you look at the health of Black women, it's steady being declined, right? And so what that is telling us, and what it is saying, is that even though we are exercising our right to vote, and that we're becoming more electoral and being more the electoral process, then when it comes to what's actually paying off, that is not happening. We are not seeing that. And so some of the things in terms of Black women, to give a couple of examples, the average income for white women, the average wealth of white women, 36 to 45, is about $46,300, or $43,600. For Black women, it's $5 in the same age round. For a Black woman with children, or single Black woman with children, goes to 0. In terms of infant death, 1 in 10, how to put this? 1 in 10 infant deaths, if you look at infant deaths across the board, 1 in 10 of infant deaths are from homicide. So 1 to 4 years old, 1 in 10 of them are killed. If you go up to 15 to 19-year-olds, that's 1 in 4. So in terms of death for young Black folks, or particularly young Black women, it is by homicide. That is the second cause of death for essentially Black women from 1 to 19. 1 in 22 Black women is said to get HIV in their lifetime. Excuse me, did I say that right? 1 in 22 Black women are supposed to get HIV in their lifetime. And when you look at STD rates, I work in California specifically, gonorrhea rates for Black women are about 25 times the rates of white women. And in terms of chlamydia, it's 18 to 19 times the rates, right? So when you look at, you had a question? Yeah.
Oh, can you just repeat the first statistic about the $5 versus 45? Can you just repeat it one more time?
Yes.
In the process.
I'm sorry. So for white women, 36 to 45, their age range.
Okay.
They have an average wealth of $43,600.
Okay.
And for single Black women in the same age range, it's $5.
Okay. Thank you.
Sorry. I know it feels kind of like it seems like a crazy stat, right? But it's for me, when I learned this, it was pretty shocking. And so these are I can go on a litany of health issues and health access for Black women. But this is what's essentially that's going on in a snapshot of Black women, why we are continuously raising our voice to vote. And so it is a particular time in our history that we can use, that is very important to organize, and that we have a base to organize in. You guys still with me? Does that make sense? Mm-hmm. All right. So, but one of the things that while we're doing our organizing work, I wanted to talk about some of the challenges and some of the ways that we can address some of the challenges in organizing Black women, and some of the issues that I see in the work that's going on. So one of the challenges is disconnection, right? And what I mean by disconnection is a disconnection in terms of, a lot of times we are speaking to the choir. We talked about that in our last session. But we have a tendency of yeah, we need to all have reproductive health, we need to all have access, we need to have all these things, we talk about abortion rights. But then when we get outside of our comfort zone, we're not having these conversations with our base. And going the door to door, having those conversations with people and where they're at, right? So when we do have these conversations, sometimes we have them talking about intersectionality, and the gender spectrum, and all these other words that most folks don't use in their everyday vocabulary, right? You guys know what I'm talking about?
Yes.
Right, and so one of the strategies that we use in terms of addressing and talking to Black women is reaching people where they're at, having those conversations, and seeing okay, I can relate. I want to hear your story, having those listening conversations, but also hearing about, not talking about maybe intersectionality, but talking about what we saw in Love and Hip Hop and how that is an issue around reproductive health, right? And the reproductive access and the perception of what's going on. You guys still with me? Yes? Okay. Another challenge that we see coming up is that the whole trope of Black women are doing okay. right? We have a whole issue and whole initiative around black men and boys about how state violence, police violence, how things are going so wrong for them. But then when we talk to black women, besides outside of black women, it's, oh no, I think they're doing okay. Everything's okay, right? And not being able to hear, if we don't know there's a problem with me, then we're not going to be addressing the issues on that solution. So one of the solutions is sharing our real stories, having conversations with black women, and but also having those conversations and making and amplifying those voices to talk about what are the issues that are impacting black women, that they are issues that are impacting black women, and that we need to address those, and that we can also like chew gum and walk at the same time, which is essentially is we can look at the issues that are impacting men and boys. And I know this is very, talking about very kind of gender specific, but we can talk about what the issues are impacting black men and boys, and then also talk about the issues that are impacting black women and girls at the same time and address them. Being black and woman is not enough. And so this is actually something that's both an external and internal voice of things. And so externally, a lot of times, I know when I'm doing work, I am often asked, well, are you talking to men? Are you talking to boys? Or are you working with all other women of color? Like for some reason, the issues of black women are not enough to tackle, that we need to expand our base or expand what we're doing. And so those happens, that also happens when it comes to funding. When we're saying, no, we really want to work with black women and girls because if these issues are impacting us, we want to work with this community because look at these disparities, or that we want to organize this community, we're always having to have this kind of conversation on why it's just enough to have to look at black folks, right? And so I have the solution of being unapologetically black. I don't know how much that has helped yet, but having these conversations about what are the issues that are impacting black women and why we need to be addressing them is a constant conversation that helps to push back against this narrative about, it's just not enough to look at black women and girls. I also want to turn in terms of internally, this is also where it goes back to this constant kind of like back and forth between kind of civic and social movements and the black womanist movement in terms of can we look at the issues like state violence and what are going on with black men being killed by police, and then also at the same time look at the state violence that are happening with black women, right? That we don't really hear about, but does very often happen. And then is it this conversation about, okay, well, can we look at them at the same time, or do black women have to have this take a back seat in order to support this kind of violence that we see around black men, and say, well, okay, since you're not the face of it, sit back and we'll get your little women's issues later, right? And having to have those conversations within the community about, no, black women's issues are just as important as the issues impacting men. Oh, okay, sorry, I'm using, thank you. So, another challenge is the elected officials not responsive. So at the beginning I just said, at the beginning of this I said, black women are voting. We're doing really good at voting, right? Like we could be doing better, but we are voting. However, elected officials seem not to be hearing us. And one of the things that has to do is that we happen to vote and then we walk away. We don't hold our elected officials accountable to the issues that impact black women, and we are afraid to ask them to be accountable to the issues that are impacting black women, right? So it goes into this conversation about, well, not this conversation. So when we vote, we don't see how they voted, right? We don't see where they showed up at. We don't ask them to come to our community meetings. We don't show up and light fires on their porch or, well, okay, this is kind of a personal story, but we light some couches on fire for a person's birthday, which got us in a little bit of trouble. But essentially, when it comes to that work, we kind of tap out. But we sure would, next election time, right, when they come to our churches, we sure do tap out some money and then go out in bus loads to go and vote, right? And so one of the things, and the solution is electoral organizing, right? Which is different than base building organizing or community organizing, which is extremely important. Community organizing is extremely important, but it's also going door to door all year round and looking at having these conversations with their communities, and then having them see the reproductive justice issues that we talk about, what are the issues that we are important to them, see how their legislators voted on those issues, and then make sure when it's time for an election that they show up, right? And tell those elected officials, yeah, we got you in here and we can take you out. And that also is making sure that we identify women leaders, Black women leaders that are able to take the reins. In LA in particular, we had a seat that was held by a woman, a Black woman, for the last 26 years. Karen Bass came through that seat, Diane Watson came through that seat, Holly Mitchell came through that seat, and that seat is now, it was a special election, we looked high and low trying to find a Black woman to run for that seat. And they were all afraid to, because of the Old Boys Club got together and scared the one woman that they had been grooming for that seat to not run, and had her run for college board instead of for state assembly, which is, college board is a part-time gig, by the way. State assembly is a full-time gig, and leads to a lot of other higher offices, including congressional and our also city council, which is something really important in LA. It makes $190,000. But when we did that, we kept looking for women and they were afraid. And so one of the issues is identifying women, and then also making sure when we identify these women to give them the tools to run, right? As much as we can as a 501c3, and then when it can have a soft handover to folks who we know, right, who can help them on the other side. So we have a lot of leadership programs that you say in terms of like, oh, we're gonna help women vote and things like that, but are they gonna help you talk to a campaign manager or talk about fundraising in the real way, or getting the ground game on, because all of these things are really important that we don't do with when we're trying to get folks ready to run for office. So. And then the other challenge is the political landscape. Both of my compadres here had talked about what's going on nationally, and it's looking pretty scary, right? In terms of what has been, or what is not going on, I would say, nationally, in terms of passing bills that that reflect the needs and wants of our communities. But one of the other things that are going on there is the state-based attack that conservatives are going through states, a lot of ones with people of color, and essentially passing some pretty terrible laws. And a lot of us don't think like, oh, we need to pass something federally, and not say like, maybe we should pass something in our city. Maybe we should pass something in our state. Maybe we should get some people elected in the city and state and figure out how to do those things that way, right? So we could use a national platform or a national bill to pass something during the states. So the solution for that is keeping it local and working locally while we organize, try to get folks together and pass legislation that can have real impact on women's lives, Black women and girls' lives in the states that they live in. So for example, a couple of bills that we've worked on, AB 154, which is our early abortion bill, we passed in California. Half of the counties in California did not have access to an abortion provider before this bill passed. We had it for nurse practitioners, physician assistants, and certified midwives be able to perform first trimester aspiration abortions. We've also passed a bill making sure that the sterilization of women in prison stopped, which was something that we found out was still going on illegally in California. We worked on that. We've expanded comprehensive birth control in the state. We've expanded privacy laws in terms of if you are a teen and on your parents' insurance and don't want them to know from the co-pays or from the insurance claim what you've been asking your doctor for, that we've expanded that for, we figured that out at the doctor's office where they won't get a bill saying your daughter came in here looking for contraception, or your son came in here talking about STDs or contraception. We also looked at, I think that's a lot of good stuff. We're working on diaper bills right now, right? Because there's one thing to say, to have like, oh, we want women to be able to have childcare, but you know, when you have childcare, you need to have diapers for the whole day, or to give them diapers for the whole day. And diapers are quite expensive. I did not know that until I was buying, I had a lot of baby showers recently, and I was like, oh my God. Okay, and they go through about 10 diapers a day? Whew. And that was like a kind of moment for myself to realize, okay, somebody buying diapers, this is really expensive. So we have one to try to take the tax off of diapers, and then also one for women who are on CalWorks, which is our, what is it called? Our Welfare to Work program. There you go. What do they call it outside of California? That if they can use their vouchers, some of their food vouchers, essentially to buy diapers. We also have a bill looking at CPCs, or crisis pregnancy centers, which I don't know if people are folks familiar with crisis pregnancy centers? I'm going to say it anyway, in just in case. So they are essentially these centers that look like clinics until you get inside, and essentially they are tricking or sometimes kidnapping, well, holding hostage women to talk about them on why they should not choose abortion, right? And I've heard stories of folks who have been trapped in those essentially CPCs for hours, getting talked to about why they need to have their baby, and that they're sitting or how they won't ever be able to have a child again, and complete misinformation. So it's another bill that we are trying to essentially, for folks who are, oh, one more minute. Why is it talking that long? Okay, for women who are trying to get into, or at least for women to know that if they're going to a CPC, that they have to tell them that they're a CPC, because that's not required now. So folks who are going in, they're thinking they're still going to a real clinic. Somebody has a doctor's jacket on and they have no idea that this person is just the homie off the street who decided that wanted to give some information to you, and that's it. And they are very often, especially in places of color, located very closely to real clinics. So folks actually get lost trying to go to the real clinic and end up in CPCs. So there are a lot of really good things that can happen on the state level. And if you'd like to know more about that, I'm out of our legislative report card that we did with Access, Women's Health Justice, and California Latinas for Reproductive Justice, which is two of our sister organizations. But I do have some information about some of our civic engagement strategies and our Get Smart Before It Gets Sexy program, which is to address the stigma around sex and reproductive health with Black women and girls, and particularly young Black women. And that is it.
Thank you.
So now we're gonna, hear from y'all, get some questions from y'all. I was thinking that though the conditions that we're facing are they're pretty intense, the pushback is incredible. There's some really incredible, inspiring work that's happening locally and also nationally, and incredible collaborations as well. And I believe that I think the thread with all the work is that, policy work without base building, like, you can't do it, right? Like, we have to make sure that our people's voices are central, are leading the charge, right? And that they will be transformed in doing this work, right? So I'm not a victim. Like, I'm on page 16. I have my, you know, the Declaration of Human Rights. I can share with you, like, how this experience tried to marginalize me, but now I'm in a different place. So really, that narrative of, like, I'm reclaiming my story is also really, really huge as well. So I didn't know, I wanted to turn it over to y'all to see if y'all had some questions, or wanted to also say, hey, we're doing this in my local community.